Everybody, and happy Thursday. Today, I wanted to talk about an expanded definition of trauma that I use in therapy with my own clients. And I not only wanted to talk about this expanded definition, but how we might even know in our own lives if we have resolved or worked through some trauma. And so, I think a lot of people, when they think of trauma, they think of things like the ER, a car accident, divorce, kind of the big things that that are more easily definable as trauma. But trauma is also the things that happen to our the things that happen in our lives in which we respond and we see the world, ourselves, or others in a different or negative way as a result of this thing happening. So it could have been family dynamics growing up as a kid that we misinterpreted because we were using a kid brain to understand them. It could have been simple words that were said. I think one of the ones that gets written off a lot in my sessions is when a client was bullied in the past or somebody said something to them and they think in their minds that, because as adults we're like, well, I know better. I know that that didn't mean anything and, that kid was just being a jerk. But when we're little, we don't necessarily know better. And sometimes our brains will change the way that we see ourselves, the world, and other people, and create new ways of believing or seeing the world as a result of a silly comment, so to speak. And so I like to explain that to people, that when things happen to us matters too. Because if something happened to us as a kid, it could be perceived more or become, I guess, what we call trauma because of the fact that our brain was in a different developmental stage. And so every single person, nobody in this life is unscathed from the effects of trauma. Now, whether it becomes something like PTSD and actually creates those symptoms is a little different, because I don't believe that all the little t traumas are necessarily going to result in the diagnosis of PTSD. Although little traumas chronically could, potentially. But little t traumas, what they do to people is they still change the way that they view the world. They can still shift their paradigm or their mental model and hold them back in really little ways that people don't always see or notice. So they could hold them back in their career and their relationship and the way that they might extra respond or be sensitive to something where another person might not be. Those are the subtle ways that those little t traumas can show up in our lives. And even today, I actually had a session before this, and one of the things that was really neat is in the work that I do, sometimes we're able to reflect back and see how their lens has changed over time, and how they're able to see the world differently and make different decisions because they've worked through and resolved some of their traumas. And so one of the ways we know that we've actually been working through or resolved trauma, whether in therapy or sometimes experientially, we can resolve trauma by having healthy experiences, is when we're able to look back and notice that in a situation that we would have maybe responded in anxiety or anger, or that would have put us in a funk for days, that we're no longer experiencing that we're starting to build trust in ourselves and confidence in ourselves. And the other thing too is also showing that we're starting to build trust in life. So for instance, with my client, I'm trying to de-identify this story, but essentially they had worked through some of the trauma that they were needing to work through because they were able to remain non-anxious and calm in a situation that normally would have put them in a tailspin of anxiety for an entire weekend. And the ultimate reason they were able to do that is because over time, as they've been able to resolve some of these trauma narratives, they now trust that they can get through hard things and that they can be okay making it through this conflict or situation. Before, they didn't have that trust. They didn't have that trust that in the end things would be okay or that life would be okay. But now, looking back, they were able to respond differently to this situation because foundationally, they started to trust that they could handle it even if something bad did happen. So one of the ways we see people resolving trauma in their lives is when they're able to have more of that trust and confidence in themselves. Sometimes people call it confidence, I call it trust. But they have a confidence in themselves, and they have a confidence that life will be okay, that they're going to be able to make it through the hard thing, even if things don't go exactly the way they hope they will. I hope that some of that was insightful to you. My purpose in sharing that is, again, I think people have differing definitions of trauma, but I've really found that this definition is the most useful and the most helpful for my clients. And a lot of it, I have to give credit to Dr. Gabor Mate, because he was able to put it into words what I had felt and seen in my clinical experiences, how trauma is more about what happens inside of us than what actually happens externally. And it's anything, again, that changes our view of ourselves, the world, or other people in a way where we have less trust, where we see it negatively, and we start to react in all those what you'd consider typical trauma responses as a result of that thing, right? And so that helps us understand how these little things that happen throughout our life can also impact us in addition to the big things. And for some people, if they have the right supports and resilience factors set in place, sometimes the big things aren't actually traumatic, that other people might describe as traumatic. So that's another part of this to consider. But essentially, when we're all going through our mental health journeys, the more we're able to resolve our traumas, big and little t traumas, we are able to actually put ourselves out there in the world and be confident and be loving, because we can come from a place of trusting ourselves and trusting other people, and ultimately trusting that the world is a pretty good place. I know that it's not a perfect place, and I'm not saying live in la la land, but that we trust that we can make it through hard things and that we will be okay in the end. I hope you guys have a wonderful Thursday. I feel so honored to be with you during these Coffee with a Therapist YouTubes. So I hope to connect with you tomorrow. And just as a friendly reminder, I am actually going to be taking some time away, so I will not be doing a video on Monday. I will be doing one tomorrow, but Monday I won't be doing a video, so tomorrow will be the last one for this week, and then we'll start back up on Tuesday. Take care, be well, do some belly breathing.